Hi. How's it going after 2 weeks?
Just fine. I really like her. And I can't figure out why the rest of you don't.
Hey, Doctor, I'd like to speak to you about my wife.
Mr. Reynolds, what would you like to know?
I'm very concerned about the attention she's getting here.
I just don't think that the staff pays enough attention to her. I don't think she's too demanding or complaining. I let Mr. Reynolds feed her today, and they both really liked it.
Do you think it's wise on your part to make this kind of decision? What if she would choke? How would he handle it? I know you're here to learn, and I know you like to try different things. But just because you have time, remember that we don't. Please don't spoil her for us.
2 months till I graduate, and now I find that all this stuff about personalized nursing care for the individual patients is for the birds. You give them their baths, you do their treatments, you change their beds. That's what nursing is. And Mrs. Reynolds, she isn't a person. She's just bed 1, room 14, and an order sheet. And that poor old man who hasn't got anyone else in the world except his wife, and who wants to help, and who hasn't got anywhere else to go. He's just a thing that gets in our way. Banish him. Get him out of our hair. I will be a good girl and get a nice, shiny degree. I will be the doctor's soft, feminine, and efficient handmaiden. And perhaps in a couple of years, I'll be a wonderful head nurse like Mrs. Jenkins, admired and respected by all, who doesn't care in the least that Mrs. Reynolds is a poor, frightened woman who's afraid she's going to die.
I ran into the problem quite by chance.
Well, hi, Stephanie. How are things going? Well, if you really want to know, Miss Little, if I don't talk to someone, I'm going to blow my top. Well, do you have a minute? Why don't you come into my office? My name's Stephanie. Sit down. Thank you. Well, what's the problem? I guess it's Mrs. Reynolds. I think that I know how to take care of her, and yet I'm really wondering if the staff here does.
It seems to me, Stephanie, that the staff spend more time with her than any other patient on the ward. I think they're doing a good job against big odds. Look at her skin. It's perfect. She doesn't have any contractures or foot drop, and we haven't had any lung complications with her tracheotomy.
Well, I know, but that's what you do for any patient. And Mrs. Reynolds isn't just any patient. She's a person.
She's an impossible person to satisfy.
But no one tries to. They avoid her. All these requests for a drink of water and suction my tracheotomy and bring me the bedpan, they're just ways of getting attention. She's afraid. I think she's afraid of dying. And her husband, he's afraid too. He wants to spend every minute that he can with her. She's everything he's got. Look, I've had this in theory until it's running out of my ears. You plan personalized patient care around the needs of the individual. The physical needs, the emotional needs, the environmental needs, the socioeconomic level, the rehabilitation needs. They're not doing that here. Sure, this is a great word for physical care, and Mrs. Jenkins is just top. Well, if I ever had a head injury, this would be where I'd want to come. But that's only half the problem.
In this mirror, I see myself, and I don't like what I see. Most of what she said is all too true. I know all these things myself. How could I have lost sight of them?
Why doesn't anyone pay any attention to me?
To me, she's just been a difficult patient. Why couldn't I see her? I've been concentrating on the same old things. Staffing the wards, hospital policies, routines, doctors' problems. I've been blind to this patient's problems and to the real needs of the staff. What am I going to do now? Some people you can talk to. Our psychiatric instructor is one of them. I needed help, and I went looking for it.
Hi, Betty. Well, hi, Dio. Boy, did you send me a prize package in that little student, and have I ever got a problem. Can I sit on your couch and tell you about it? Sure, sit down. Have a chair.
I realized the kind of leadership I had provided the staff. We had missed the boat with this patient for 4 months. One of the difficulties on a busy ward is that no one takes time to study a nursing problem systematically. We're all too busy with tasks to stop and look at what's happening. But we've got to stop, and it should be worth the effort. What we can learn from studying Mrs. Reynolds' care is bound to affect the nursing care of all other patients on the ward. First, I had to get the staff to see Mrs. Reynolds as a human being. Expressing my feelings about her allowed them to get their own feelings out into the open where we could look at them together. What else? Come on, I feel the same way.
Oh, she's always calling us honey and dearie, and boy, that just gripes me.
Well, I don't mind that, but she's always talking about us behind our backs.
That isn't all she does. She reports us.
So does her husband. He watches everything we do.
Okay, let's stop. Isn't it strange that not one of us has said a single good word about her? Okay, what do we mean when we say it takes so much time?
Before you even do anything, she has 10,000 complaints.
I'll bet it takes an hour and a half to feed her.
What do you mean it takes an hour and a half to feed her? Do you time it?
What would happen if we kept track of everything we did for this patient for a few days? That's a darn good idea. Let's write down everything we do for her, including her requests and demands.
Maybe then we'll get more help.
I wasn't worried that the staff felt that this was a chance to prove something to me. I was sure the study would mean much more to all of us.
Now, you just take your time, Mrs. Reynolds. Don't hurry at all. Just take lots of time.
Just rub my legs, dearie.
Why, sure, Mrs. Reynolds, and anything else you want, just ask for it.
You just let us know when you want us to section you again, Mrs. Reynolds.
You must not be very busy today, I guess.
Never too busy to make you comfortable, Mrs. Reynolds.
Here's that nice cold water you wanted, Mrs. Reynolds. Now, if you need anything else, you be sure and let me know. Thank you. What are you writing on that piece of paper, dearie? Why are people being so nice to me?
Wait till the supervisor sees this.
7 hours and 42 minutes a day of tender, loving care.
Let's do this up real pretty.
Care which for 4 months had been anything but tender and loving for any of us. But without really realizing it, all the staff was beginning to be interested creatively for the first time in the care of this patient.
The prize package.
I guess this should make her sit up and take notice.
She thought she had me right where she wanted me, but her interest had been caught along with all the others.
Thicker than my life history. You're real sweet.
Okay, now what have you got for the totals for this? At the next meeting, I made sure that everyone had copies of all the data, and we summarized it together. And once we had the facts before us, they seemed to ask their own questions. Why does she have to ask for more coffee?